Hello friends, let us now learn some important points about splenomegaly. Splenomegaly is increase in size of the spleen is called as splenomegaly. Actually, the normal size first if we see, the normal size of the spleen is around 12 to 13 centimeters. According to Rosenberg et al. Has given in ultrasound book, it is 12 centimeters in girls and 13 centimeters in boys. So if we have to take an average, it is around 12.5 centimeters. In the splenomegaly, first, what is the differential diagnosis or causes of splenomegaly? Okay, that is we should learn first, and we should also learn what is massive splenomegaly. So, okay, normal size of spleen is 12.5 centimeters. So more than, if anything more than 12.5 centimeters or 13 centimeters, we can call it as splenomegaly. Then anything which is more than 18 centimeters, if you measure the spleen and if you get that spleen to be more than 18 centimeters, then we can say that it is massive splenomegaly. So we have to learn what are the causes of normal splenomegaly and what is the causes of massive splenomegaly. So first we will see splenomegaly. The causes. The causes can be differentiated into different types. First we have hematological causes. If you remember, spleen is the site where the RBCs or blood cells will degenerate or they will break down. So the RBCs and any of the blood cells, if they are deformed, causes of hematological causes of splenomegaly, anything related to RBC. If the RBC is defective in any way, whatever the reason may be, if RBC is defective, those defective RBCs, once they reach the spleen, the RBCs will get destroyed. Okay, and as a result, now the spleen is working more. When the RBCs are destroyed, the spleen is killing the RBCs. So the spleen is working more. So as a result, if the RBCs are destroyed more and more and more, then the spleen has to increase its capacity in order to um, kill more and more RBCs. And as a result, this results in splenomegaly. So what are the diseases where RBCs are defective? So there can be some red blood cell membrane defects. There can be red blood cell membrane defects like spherocytosis and eleptocytosis. There can be some hemoglobinopathies like thalassemia or sickle cell anemia or any type of hemoglobinopathies. There can be some autoimmune hemolytic anemias. These autoimmune hemolytic anemias can be warm or cold autoimmune hemolytic anemias or paroxysmal cold autoimmune hemolytic anemias. So, in all of these, one thing that is important is there is a defect in RBC. So because there is a defect in RBC, spleen obviously it will destroy the bad RBCs. It will only let the good RBCs survive, whereas it will kill the bad RBCs. So when the bad RBCs are dead, so when more and more bad RBCs are present in our body due to any of these defects, this will have now the spleen has to work has to increase its work in order to kill more RBCs, and as a result, this results in splenomegaly. Right now, among all these hematological disorders, one important thing is thalassemia major. In thalassemia major, the beta chains are excessively produced. Sorry, beta chains are completely absent. Sorry. In thalassemia major, that is beta thalassemia, beta chains are not produced. So, as a result, the hemoglobin here is defective. It is one of the hemoglobinopathies which requires transplantation. Sorry, which requires transfusions, repeated blood transfusions. So, thalassemia major is a hemoglobinopathy which involves the beta chains. that is due to the deficiency of beta chains, the child's RBCs are defective. So as a result, the child will have low amount of hemoglobin, and the child requires multiple blood transfusions. So in such conditions, we see massive splenomegaly because the RBCs which are produced are defective, and all the RBCs undergoes degradation in the spleen, resulting in massive splenomegaly due to thalassemia major. Then next, the next important cause is rheumatological causes resulting in splenomegaly. In rheumatological causes resulting in splenomegaly, we have rheumatoid arthritis. In rheumatoid arthritis, in systemic lupus erythematosus and sarcoidosis. In all these conditions, there is immunoglobulin production. Okay, antibodies, autoantibodies especially. These are rheumatological conditions where autoantibodies are produced. And as a result, in these conditions also, spleen is increased in size, that is splenomegaly is seen. Then, next important thing is infections. Infections causing splenomegaly. Whenever there is infections, these infections like some viral infections, the infections can be due to viruses or some bacterial infections. There can be viral infections or bacterial infections. Okay. There are some viral infections, bacterial infections, or some mycobacterial infections or fungal infections and parasites. If you remember, the spleen is actually a site where phagocytosis occurs in spleen, and it is also responsible for the immune response. So as a result, whenever there is infections, any type of infections, so the spleen has to produce more and more. So whenever there is infections, like all these infections, these will affect spleen, and the spleen has to produce more and more immunoglobulins to tackle these infections. So as a result, in response, the spleen increases in size, resulting in splenomegaly. Among the infections, one important thing which is there are some severe infections like visceral leishmaniasis, which is caused by leishmania donovani. Then we have hyperreactive malarial splenomegaly syndrome. In hyperreactive malarial splenomegaly syndrome, obviously, as the name says, it is caused by Plasmodium, which is a malaria causing agent, and here splenomegaly is seen. And in Mycobacterium, and in a type of Mycobacterium avium intracellular complex. So, in all these conditions, we see massive splenomegaly. So, in these conditions, we see massive splenomegaly. So, massive splenomegaly is seen in visceral leishmaniasis, hyperreactive malarial splenomegaly syndrome, Mycobacterium avium intracellular complex. In these three, we see massive splenomegaly. Then we have congestive causes causing splenomegaly. So, if you remember, we have superior mesenteric artery. Then we have splenic, superior mesenteric vein. We have superior mesenteric vein and we have splenic vein. Both these combine together to form a portal vein. Okay, now this is spleen. So one important thing is whenever there is congestion, okay, one example is hepatic cirrhosis. Whenever there is cirrhotic changes in the liver, this will result in portal hypertension. Okay, so this portal hypertension, there is increased pressure in the portal vein. So this will also have back pressure causing increased pressure in the splenic veins. That is, increased blood in the splenic vein is also seen. Congestion is nothing but increase in blood. As a result, this because of increased pressure in the splenic vein also, the spleen starts to increase in, because if you remember, the spleen consists of two areas. We have white pulp and red pulp of spleen. And if you remember, this red pulp mainly consists of sinus. Obviously, whenever there is increased blood or volume of blood in the portal vein, which goes, which can cause back pressure into the spleen, causing increased blood volume in the splenic vein, which can go back into the spleen, thus causing dilatation of spines, resulting in splenomegaly. This is due to hepatic. Second, whenever there is thrombosis, any type of venous thrombosis, especially if the thrombi are present in either splenic vein, if the thrombi are present either in splenic or hepatic or portal veins. Okay, this is step number 2. Why? Because if there is a thrombi, splenic, portal or hepatic, the blood, actually the blood which is in the splenic vein, this blood, and also superior vena cava, blood in superior mesenteric vein, blood in splenic vein, blood in mesenteric vein, both these are drained in the portal vein, right? So whenever there is thrombosis in splenic vein, this drainage of the blood is hampered, and as a result there is increased blood volume present in the spleen, dilatation of sinusoids, leading to splenomegaly again. Third, there can be some volume overload conditions where the whole body, the blood volume in the whole body increases, like in congenital heart failure, congestive heart failure. In congestive heart failure, there is pedal edema. You can see there can be ascites also. Sometimes there can be pleural effusion can also be seen. Actually, congestive heart failure, there is increased blood volume inside the blood vessels. So as a result, congestion of different organs is seen. Similarly, congestion of spleen also result in splenomegaly. Then the next important cause of splenomegaly is infiltrative disease. Group of disorders causing splenomegaly are infiltrative disease. Infiltrative disorders mean there is infiltration, that is, lymphomas can be due to lymphomas or myeloproliferative neoplasms, or there can be some metastatic cancers which might invade the spleen and invade the spleen. These metastatic cancer can invade the spleen and they can cause increased growth of the volume, growth of the cells, resulting in splenomegaly. There can be amyloidosis, where the amyloid gets deposited in the spleen, causing splenomegaly. There can be Gaucher's disease, where where some polysaccharides or the some of the lipids get deposited in Gaucher's disease, or in some sphingolipidosis like Niemann-Pick's disease, or there can be glycogen storage disorders where the glucose, uh, the remnants of glucose or the different intermediates of glucose metabolism are deposited in the spleen, or there can be hemophagocytic syndrome, or in Langerhans cell histiocytosis. So in all these conditions, some of the important materials get deposited in the spleen, resulting in splenomegaly. Among all these conditions, lymphomas, myeloproliferative neoplasms, and Gaucher's disease. So, lymphomas, myeloproliferative neoplasms, Gaucher's disease. Among all these three will cause massive splenomegaly. These are the different causes of splenomegaly and massive. Thank you.